Vitamin D offers an unexpected yet shocking benefit to your overall health that you need to know about. Hey Wellness Warrior, I'm Dr. Zyrowski, and vitamin D is needed by every cell in your body. Every cell in your body has a receptor for it. And vitamin D is the only vitamin that you don't have to get from outside sources, meaning that your body actually produces it. This goes to show us how important vitamin D is to our overall health. And in this video, we're going to talk about how vitamin D is critically important for the avoidance of a major health condition and also improving your brain health. So let's go ahead and first look at the Blue Cross Blue Shield reports and what they found. Blue Cross Blue Shield, which is a major insurance provider that looks at the health of many individuals, what they found is that under the age of 65, between the years of 2013 and 2017, there was a massive 2x increase in early onset dementia and Alzheimer's in people under the age of 65. Now, this is pretty incredible and also alarming. The other thing that they found is that the average age of early onset dementia and Alzheimer's is now 49 years old. And I'm going to get to just a minute how this pertains to vitamin D. First, let's take a look at how do you know if you're actually falling into this category. And the thing is that there's people even the age of 35 that are having all of these symptoms of early onset dementia and Alzheimer's, and they don't even know it's happening. You could be one of them. Some of the symptoms are things like brain fog, forgetfulness, also poor brain endurance, meaning that you're performing a task, maybe it's focusing at work or even focusing on some household duties. And the thing is that when you're trying to really focus, you lose that brain energy. You had about 15 minutes where your brain was working and then it checked out. Brain endurance is not there. Also, inability to focus and just general confusion. These are all very common signs that you may be facing. So let's go ahead and circle back to how this actually pertains to vitamin D. Now, in JAMA Neurology, what they found is that there's many factors associated with early onset dementia and Alzheimer's, and vitamin D happens to be a major one. Now, the Journal of Alzheimer's and Dementia, what they found is if you take vitamin D in the form of supplementation, it would decrease your risk of early onset and dementia by 40%, which is huge. So what we can tell is that a vitamin D deficiency is very important for your brain. And when you have a deficiency, not only are you more likely to have all of these symptoms right here, but you're also more likely to develop dementia, which is obviously devastating if you know of anybody who went through it. When we look at vitamin D, the big question becomes, well, are you supposed to get it from food? Are you supposed to get it from sunlight? Where are you supposed to get it from? Or even supplementation? Well, the fact is getting it from food is very difficult unless you eat an enormous amount of fish, and that's almost all you eat. So we're going to kind of put that aside because 99% of people are not going to get adequate amounts of vitamin D from food. Now, the other thing to consider is sunlight. However, everybody tells you sunlight is bad for you. The fact is that sunlight's actually not only good for you, but critical for your overall health. And it's estimated that if you get at least 30 minutes of sunlight per day hitting the skin, it can give you adequate amounts of vitamin D in your body. Unfortunately, just because of how people work indoors today and a lot of desk jobs, most people are not getting that 30 minutes. If you're like me and you live in a cold climate, you're definitely not getting that 30 minutes a day. So that's another thing that we have to consider. The other thing that you can do is supplementation. This is what I do personally. This is what I recommend for most people. That is, taking around 5,000 IUs of vitamin D is going to be really adequate for the average individual. And what I'll do is I'll put a link to the vitamin D that I use in the description below, because it's very important to make sure that you're getting a vitamin D that first of all is absorbable, but also in the right amounts with the right ingredients so that you absorb it, and the vitamin D actually goes to supporting your body appropriately and not building calcification within the organ systems. So that's why the proper vitamin D is very important. So this is the way that we can get adequate vitamin D in our life. Now, when it comes to the risk of dementia in early onset Alzheimer's, one of the things to consider too is two other major factors were going to be inflammation, which is in the body, inflammation in the body, which ultimately is going to mean inflammation in the brain. One of the things that's interesting about that is if you take vitamin D, it'll actually help lower inflammation in the body and in the brain. And then the other big factor was just social isolation, which was a major risk factor, which I want to give you those 2 points as well, because if you're trying to avoid dementia and early onset Alzheimer's, we have to make sure that we're doing all the right things. So the one thing that's very important is making sure that we're getting adequate amounts of vitamin D. If you're not sure of what your current levels of vitamin D are, you can go ahead and check in the description. I'll put some resources as to how you could test easily at home, or you could ask your doctor to test for you, because we want to make sure that we're not on the borderline or even in the state of having a depleted amount of vitamin D in our body, because we know not only is it going to increase our risk of Alzheimer's and dementia, but also have a negative impact across our entire bodily health. So if you enjoyed this video, I'm Dr. Nick Zyrowski, and I think you'll really like this video on vitamin D next.